Welcome back to episode 5 of Focused Antenatal Care, of which we are discussing this particular booklet. And in the topic of today, we are going to talk about care of the mother and the baby after birth. Of course, we have done season 1, 2, 3, and 4. And if you have not watched those particular seasons, kindly those videos are available in the description box below. If you love this channel, hit the notification bell written subscribe, turn it on for more videos that we'll post. And if you love us, this M-Pesa number, kindly contribute something to enable the channel to grow. Now, let's continue with our discussion about the care and of the mother and the baby after birth. Now, we are going to consider the pictorial outview of what is located in this particular book on page 17 of 44 if you have an edition of this particular book. Now, the first thing that we should be able to do to the mother is that the mother should eat 2 extra meals during breastfeeding period. And breastfeeding is very, very important. And how this mother is going to eat this particular food, we have the scale of the servings that is supposed to be eating, and I'm just going to take you through. At least you should have around 1, 2, 3, 4, 5, 6, 7, 8 glasses of water on a daily basis. And of course, starches should be around 6 to 11 servings, and you should be eating them mostly because starches are carbohydrate and they normally help to give energy and strength to this particular mother who is now in puerperium, and she needs a lot of energy to breastfeed the child. And even fruits is also very, very important, and this one you eat generously and about 2 to 4 servings. Animal proteins, you eat 2 to 4 servings. And also vegetables, and here we have kales, we have cabbage, we have carrots, we have onions, we have tomatoes, and you eat them 3 to 5 servings, and you eat them also generously. Plant proteins 2 to 4 servings, and you eat regularly. Fats, oils, salts, and sugar, and these ones you eat sparingly because we do not want you to be obese. Now, these are very, very important to provide nutrients for the mother and even development of milk let down to help this our particular baby during breastfeeding, and also to nurture the mother's body because she has just delivered. Now, give only breast milk to the baby. Before we brush a bit of the importance of breast milk, we must also advise our mothers that good positioning for breastfeeding is very, very key. We have positioning and attachment, and if you do not position your baby well, and if you do not attach your baby well into the breast, then the baby might not be able to suckle the breast milk very, very well. And what do we say in terms of good positioning for breastfeeding? We say that is the infant correctly positioned? Position refers to how the baby is, infant's head and body to be straight, infant facing the mother with the nose opposite the nipple, infant body close to the mother's body, infant tummy to the mother's tummy, mother supporting infant whole body and not just neck and shoulders. And as you can see, the pictorial that I've posted there, that is the correct good positioning and for breastfeeding. and all those 4 signs for correct positioning must be present to decide there is correct positioning. Now, correct positioning is the infant able to attach to the breast, to the breast. To check for attachment, look for 1, chin touching the breast, mouth wide open, lower lip turned outwards, more areola seen above than below the mouth. And you can see the pictorial that I've posted there to depict how good positioning should be. And this particular positioning, attachment to the breast milk, is very, very key. And all those 4 factors must be put in place. Now, in summary, what do we say about good attachment? Signs of effective suckling. How do we know that our baby is suckling very, very well? 1, slow deep suck, sometimes pausing while breastfeeding. Cheeks rounds when suckling. Baby releases breast when milk is finished or he or she is satisfied. Mother supporting infant whole body and not just neck and shoulder. The mother should play a role in this particular good attachment. How to attach? Touch the baby upper lip with your nipple. Wait until the baby's mouth is wide open. Move the baby quickly into your breast, aiming the baby's lower lip and below the nipple. Mother feel relaxed. Now, we said that during breastfeeding, show the mother correct positioning and attachment. And that is what we've talked about. And also you've also seen the pictorial of how positioning and attachment should be. Now, breast milk is very, very important, and we will discuss this importance of breast milk in a very special video. Of course, we know that it is containing nutrients, particularly the colostrum, which is very, very important for the infant, and also in this scenario, it also prevents infant for getting infections, and also in this particular breast milk, it has the correct temperature that the baby needs during breastfeeding. Now, we'll tackle more about importance of breast milk and disadvantages or pros and cons on other types of milk that somebody can give a baby, for example, cow's milk. And also we'll talk about alternative, because there are some infants that are born and their parents are dead and now there is no breast milk. Now, what supplement are we supposed to give this particular infant? This one we'll discuss in a very special video of importance of breast milk and the supplement that are used. Now, keep the baby warm all the time. Babies normally develop hypothermia, and this can result in what we call sudden death of an infant. In fact, it's called SIDS, sudden death infant syndrome. So we should be able to avoid this, because our babies or our infant has a range of temperature that they should be on. For example, we have a range of 68 to 72 degrees Fahrenheit, or if you are using degrees Celsius, this is about around 20 to 22.2 degrees. That is the normal environmental temperature that this particular baby should be. And if we don't forget about during birth, we normally encourage what we call KMC, and I'm going to tell you more about this KMC, which is called Kangaroo mother care. Now, note, the baby should be breastfed within 1 hour after delivery. Within 1 hour after delivery. Keep the baby warm, that is kangaroo mother care, that is skin to skin, the baby skin to the mother skin, that is kangaroo care. And delay bathing the baby for at least 24 hours after birth. Most of us want to bathe the baby very, very fast after delivery. So in this kangaroo method, we normally delay bathing the baby for at least 24 hours. And if preterm or low birth weight has less than 2,500 grams, initiate what we have been talking about, that is kangaroo method, kangaroo mother care, at least 18 hours per day. And all mothers are normally advised and they are counseled about this kangaroo care method. So our babies must be kept warm in relation to the care of this particular baby. And even when they are sleeping, most of us or most of the mothers normally let the baby sleep with the abdomen. That is not needed. Your baby should be sleeping on the back to avoid this sudden or unexplained death of this baby, because when they sleep while lying with their belly, they normally accumulate a lot of carbon dioxide, and carbon dioxide will outweigh oxygen. Then the baby will start becoming distressed and eventually die, and you will not be able to explain what actually has killed the baby, particularly when somebody has delivered and in the morning you find that the baby is normal and she doesn't know what happened to the baby. So this picture that I've shown to you, that is the way the baby should be sleeping. Now, sleep with the baby under insecticide treated nets, and this one we have discussed a lot, and even preventive services that we had discussed in the previous videos about treatment and prevention of malaria. And go for postnatal clinic as soon as possible. There are very many questions we normally ask when a mother has delivered after being discharged from the hospital, that is 48 hours post delivery. Most of our mothers normally rush to go home within 24 hours, and if you look at this our booklet, we should be able to discharge you 48 hours past post delivery. And there are several parameters that we normally look at. We normally look whether the uterus has gone back to its normal, that is involution. If you went for cesarean section, we must check whether the scar is well, there's no rupture, there's no gaping of the wound. We also check the bleeding after, if you developed a tear or episiotomy was done, then is it in a correct way? Has it gaped? Is there bleeding? Is there excess bleeding? What we call postpartum hemorrhage. Those are the things that we normally look at. Even if the mother is HIV positive, we normally give counseling and also the drugs that is supposed to be using in terms of care to this particular baby. So no rush, because if you rush, we will not be able to attend to you very well, because if you go home, then you should be able to rush back to the facility if you see the following. In fact, in the facility, we'll be able, within 48 hours, we'll be able to observe you and do the necessary when there is complications. Now, heavy bleeding. If you are at home post-delivery, you've been discharged after 48 hours and you develop heavy bleeding, that is what we call postpartum hemorrhage. Actually, a mother should, after in terms of delivery, around 500 ml average of blood should be lost. But if it is excess, if it is past that, then we term this postpartum hemorrhage. And there are very, very many causes of postpartum hemorrhage. I discussed some causes in the previous video to be causing antepartum hemorrhage, like placenta previa, when the placenta is low-lying in the uterine cavity towards the cervix, or talked about placenta abruptio, that is now detachment of placenta from the endometrial cavity, and this one normally contributes to postpartum hemorrhage. This one also will do in a very single long video about causes of PPH and even prevention of postpartum hemorrhage. So if you see there is postpartum hemorrhage, or you are bleeding in normal layman's after birth, and this bleeding is excess, makes you feel dizzy, makes you feel tired, makes you feel to drink a lot of water, you become so thirsty, kindly come back to the hospital and we will take care of you. Even fever, if you develop fever during postpartum, that is particularly in puerperium, that is 6 weeks within 6 weeks post delivery, then we should be able to take care of you and to take care of the baby, and we should be able to investigate what are the common conditions that can cause this particular fever. Of course, we'll be running several blood tests. We'll even run for malaria parasites, blood cells for malaria parasite. We'll also do what we call complete blood count to check whether there is a high level of WBC, that is white blood cells, the lymphocytes, and maybe to take care of you as soon as possible. Severe headache can be there. We have eclampsia or hypertension in pregnancy developing post-delivery. Now, if you have this, then we'll be able to manage you. So if you have a severe headache, you should be able to report back to the facility so that we investigate what is causing you this. Foul smelling or vaginal discharge. I discussed about this vaginal odors and vaginal discharge and causes. If you have not watched that video of smelling vagina, then click the link that appear up here about vaginal odors and how you can manage them. I talked about that, and this one I'm not going to talk much. And even fits or convulsions. If you develop convulsions post-delivery, you should be able to report back immediately. And also when your breasts are engorged, there's a condition called mastitis. It can be engorged because the baby is not suckling well, and that one also we can gauge and ask you several questions. Of course, we'll manage you, we'll even teach you how to express breast milk so that your breast will be relieved, because when too much engorgement occurs, an infection called mastitis can set in, and this can also bring even fever. So when your breast is engorged and you feel abnormal and you feel you are not comfortable, then you should be able to report back to the facility. Let's continue. And what about our baby? Now, our baby, when your baby stops breastfeeding, then we should be able to investigate why, in terms of why is this baby not breastfeeding, and we'll tackle this. And if your baby has difficulty in breathing, and mostly heart diseases or congenital heart diseases, what the baby has been born with. We have difficult terms here, you abide with me. We have what we call tetralogy of Fallot, patent ductus, arteriosus, and even foramen ovale, that is assistant, can make the child have this particular difficulty in breathing. And we must be able to investigate this and see why is your child developed this. Is it an infection or pneumonia is setting in? And we'll be able to manage this, even if it means putting the child in oxygen. We'll able to do this. When your baby feels hot or unusually cold, it might be due to an infection, and we must investigate this and know why is your baby becoming too much hot or too much cold, or even when your baby is less active. When the baby is born, when the baby has breastfed, she or he should be feeling happy, should be playing. But when the baby is less active, then we will be able to investigate why because there are some central nervous system disorders that normally occur to our child, and even heart conditions that can make this child be less active. Again, when your baby is turning yellow, that is jaundice, your yellowing of the skin, sclera, the palm, the soles, you should be able to investigate this. If you see your baby is turning yellow and you are at home, then of course we'll check your rhesus factors, and these ones we talked about rhesus versus rhesus isoimmunization when we are tackling antenatal profile. So when there is an incompatibility, and we'll be able to advise you further and manage this baby by a process called phototherapy that we'll do in pediatrics ward or newborn unit. And of course, when a baby is turning yellow, we should be able to investigate in terms of whether there is internal bleeding of this particular baby, or whether there is an infection on this particular baby, and we'll be able to assess and know what is happening to your particular child, and we will give this child a special care until she or he is well. And this special care, there are reasons why we give this type of special care in terms of what happens to your child. Now, when the birth weight is less than 2.5 kilograms, this is low birth weight. Normally we observe them and give them feeds in the newborn unit, and of course we put them in incubator until they attain a normal weight that they should be discharged. When the birth is less than 2 years after the last birth, it means that this particular child might not be taken care of the way it should be, and this is a special case that we take into consideration. When it's fifth or more child, parents who normally give birth to 5, 7, 6, 8 children will be able to take this child as a special child, and we give this child a special care. When the mother is a teenager, most of them, they normally deliver normally. Most of them pass through cesarean section, and they need a lot of counseling. I've done a video about teenage pregnancy and what might lead to teenage pregnancy. If you have not watched that video, click the link that appears up here about teenage pregnancy, and things will be all right, and you will be able to do. When the child the child is an orphan, the mother delivers and passes away. When the child has disability, that is born with congenital malformation, we'll take this child as a special one. And when the child has the mother has been diagnosed of HIV, and now the child is that is HIV exposed infant, will be able to take care of this particular child and even initiate antiretroviral therapy as provided by the protocol. And of course, when there is history or sign of neglect or child abuse, particularly those who deliver at home. And in this scenario, we encourage during postnatal that if you deliver at home, you should be able to report back to the facility as soon as possible, because in the other series we'll be talking about child welfare clinic. What do we do to these particular children when they are brought into the clinic? What vaccination do we give them? What happens when they develop reaction to these vaccines, or develop fever or they start crying a lot, persistent cries due to the vaccine that they are given? What are we doing as health workers to help this particular child? Of course, in the postnatal, they will be passing through clinic in terms of weight and height, and this one will be able to monitor their growth and development, and to help us to know whether there is delayed milestone or not. So it is very, very important to take care of both the mother and the baby post delivery. And if you love this channel, click this red button written subscribe, turn it on for more videos that we'll post. And if you love us, please, this M-Pesa number that appears there, just drop something small to maintain this particular channel. Otherwise, muchas gracias, and see you in the next series of focused antenatal care. Thank you.